So hello friends, in this video we will be discussing about the mycology. So the previous session was about general microbiology and parasitology was over. So whenever we are reading a mycology, first you want to read in a systematic manner. So like first, what is a causative agent? So what is a clinical picture, and what is a specific lab diagnosis and the treatment. So if you're reading in this manner, you will not miss any points. So I'll be covering this video under these subtitles only. So first, so coming for some of the classification, which is an important. So here you want to remember first there is broadly four types. One is yeast-like fungus, mold, and dimorphic fungus. So yeast, you want to remember these two, Cryptococcus neoformans and Saccharomyces. Coming for yeast-like, it is in Candida, and mold, it is in dermatophytes, Aspergillus, and the Zygomycetes. So dimorphic fungus. Okay, so these are the morphological classification. They can ask like, so among the following, which is an yeast-like fungi. Okay, like that. So you want to remember each and every point in this classification. So coming for dimorphic fungus, so this it is called as a dimorphic because, so di means it is a double, so it will be existing as hyphal form at 25 degrees Celsius and as yeast form at 37 degrees Celsius. Okay, so it is called as a dimorphic fungus. So how what are the fungus coming under this classifications are, first it is in Histoplasma capsulatum and Blastomyces dermatidis, Coccidioides, Paracoccidioides, Penicillium ornamenti, and the Sporothrix schenckii. Okay. So next is, you want to remember this term also, that is in Deuteromycota or the fungus imperfecti. It is nothing but this is most medically important fungus. Okay, so which are all used in our medical field, or it is called as an Deuteromycota. Okay. So next, first the classification we have seen is about the morphology. Okay, like morphology is nothing but it will be like yeast or yeast-like. So coming for this classification, it is so based on the diseases which is caused by the fungus. Like it is in superficial, subcutaneous, and systemic, and opportunistic mycosis. So first it is in superficial mycosis. So Tinea versicolor, Tinea nigra, Piedra. In Piedra there is a black Piedra and white Piedra, and dermatophytosis. So coming for subcutaneous mycosis, here it is in Mycetoma, Sporotrichosis, Chromoblastomycosis, and Rhinosporidiosis. Coming for systemic mycosis, it is an histoplasmosis, blastomycosis, coccidiomycosis, and the paracoccidiomycosis. So this will be causing unsystemic infestations, like it could be invading our lungs or the liver. Okay, so this is the opportunistic mycosis, means this is most commonly seen in the immunocompromised patient or the immunosuppressed patients. So here we will be dealing with candidiasis, cryptococcosis, zygomycosis, aspergillosis, penicillosis, and pneumocystis, and fusarium, that is in fusariosis. Okay, so you want to remember all the diseases which have been coming under the each classification. So first we'll go through superficial mycosis. In that, the first it is in Tinea versicolor. Okay, so what is the reagent here? It is in Malassezia furfur. There is a specific microscopic appearance, that is in spaghetti and meatball appearance, and in SDA culture there will be colonies will be like Friday colonies. So again there is a Friday colonies in the bacteriology, that is it is seen in the Mycoplasma pneumoniae. Okay, so here urease test is positive and wood lamp shows in golden yellow fluorescence. So these are the points you want to remember for Tinea versicolor. Okay, so coming for next, it is an what is the treatment? Just remember the treatment. The names it's enough, like selenium sulfate shampoo or ketoconazole shampoo or cream or terbinafine cream that can be used for about 2 weeks. Okay. So coming for the next disease, it is a Niagara. Okay, Tinea nigra, it is caused. So Tinea nigra means always it is in black colored. You can remember like that. So it is in black colored yeast, and which is caused by the fungus Horte Wernicke. Okay, Horte Wernicke. So next it is in. So black pedra and white pedra I told already. So here the black pedra is caused by Pedra horte, whereas white pedra is caused by Trichosporon bedeli. So black pedra means, just remember, there will be black nodules, but it will be firmly attached. Okay. So whereas white pedra, the white nodules will be there, but it will be less firmly attached. Okay. So just remember, both will be affecting the hair shaft, but this will be firmly attached and white pedra will be loosely attached. That's all. So next it is in dermatophytosis or dermatophytes. So remember, here we will be dealing with three species. One is Trichophyton, Microsporum and Epidermophyton. Okay. So Trichophyton usually infects the So three, just remember, skin, hair and the nail. Whereas Microsporum, I used to remember like MSH, that is a melanocyte stimulating hormone. So M for Microsporum, S for skin and H for hair. Okay. So next it is an Epidermophyton, it is an ESN, that is an, it will be affecting our skin and the nails. Okay. So coming for this, the always dermatophytes will be having a macroconidia and the microconidia. Okay. So I used to remember like TME. Okay. So PSC. P is for pencil shaped, S is for spindle shaped and C is for club shaped. Okay. So and here if you remembering like this order, it will be easy for you. And coming for microconidia, just remember tri. Tri means it is an abundant. Okay. So tri means the 3 number. So it is an abundant. So it will be abundant. So coming for micro, so it's a little. So it can be. Okay. So it can be or cannot be. So it is an rare. So coming for Epidermophyton, it is an absent. Okay. So let's remember in this order, TME. For macro, it is a PSC. P for pencil shaped, S for spindle shaped and C for it is in club shaped. So that's all. And next topic is treatment. So treatment is usually here will be giving an oral terbinafine or the itraconazole. So if there is a skin infection, it is for 2 weeks. If it is hair infection, it is for 6 weeks, and it is a nail infection, it is for 3 months. So always remember, so nail infection, the treatment will be a little longer, that is for about 3 months. Okay. So next. So this completes the superficial mycosis. I think it is easy to remember, like Tinea versicolor, Tinea nigra, black, that's a pedra, it has a black pedra and the white pedra and dermatophytes. These are the 4 diseases we will be dealing in. We dealt with superficial mycosis. So coming for subcutaneous. So as the name implies, it usually affects the subcutaneous tissue. Okay. So first in that will be that is a mycetoma. So always there is a clinical triad: swelling, sinus and granules. Okay, this is a triad for the mycetoma. So next we will be dealing with eumycotoma and the actinomycotoma. So it is always caused by a fungus, whereas actinomycotoma is caused by bacteria. Okay, so you can remember one point: either it can be a fungus or it can be a bacteria. U or actino, whatever you can remember. If you remember one, it is just opposite to the another. So okay, so I used to remember the bacteria because it is easy to remember. See, always bacteria will be, how will be, it will be in multiple tumor masses with ill-defined margin. So quite opposite here, it is a single and well-defined margin. So here sinuses, it will be appearing and early. It will be numerous with an inflamed opening. Here it will be appearing late and it will be few in number. So here purulent, here it is in serous. So white red, so here black and white. Osteolytic, whereas here osteosclerotic lesions of the bone. Here you will be seeing an filamentous bacteria less than 2 micrometer. Here you will be seeing an fungal hyphae which is usually more than 4 micrometer in the grains. Okay, so just you remember the bacteria points, so then it is an opposite for fungus. Okay, so next, so what are the agents of mycetoma? I told already mycetoma is mainly caused by the fungus, whereas actinomycetoma is caused by a bacteria. So here always remember black granules is mainly because of Madurella. Okay, so you don't want to remember the species. I am sure they won't ask what species and all. They will be generally asking Madurella. So white granules you can remember like PAF, platelet activating factor, Pseudo-Arischieria boydii, Aspergillus nudulans, Acrimonium and Fusarium. Whereas here actinomycetoma, the white to yellow, the nocardia, it is the most common species, and streptomycin and the actinomycin. So in this, just remember the nocardia. It is the most commonly asked question. And again, this is a specific question. That is a pink to red granules. It is usually seen in the Actinomycin pelliteri. Okay. Okay. So next point is. So this is a classification, and you want to remember all the organism. So here, what is the treatment? So for if it is a fungus, that is an mycetoma, it is treated with itraconazole or amphotericin for 2 years. So if it is for actinomycetoma, it is amikacin plus cotrimoxazole, that is called as a Welch regimen. Okay, you want to remember this. So next is chromoblastomycosis. So here it is a dematicious fungus. What is dematicious fungus? Is nothing but it is a darkly pigmented. That is, it produces pigments. Okay. So the call is here. So it will be like that is called as a dematicious fungus or the pheoid, whatever term can be given. So if you're coming across the word chromoblastomycosis, the first point you want to remember here, one, it is a sclerotic body, and what are the agents? So that is here is Fonsesia pedrosi and Phyalophora verrucosa, Cladosporium and Rhinocladiella. Sometimes they can ask this. Okay, so but mostly sclerotic body, if you remember, is enough. So again, treatment here, it is in cryosurgery or laser surgery, and followed by you can given the antifungal agents like itraconazole. So next, it is in sporothrix. So there is a specific term, that is, it is called as a rose gardener disease, and you always remember here 37 and 25. Okay, so 37 is like it will be producing cigar shaped asteroid bodies. Okay, whereas 25 it will be producing a flower like pattern. So just remember, if they are asking a sporothrix, first it is a rose gardener disease, so it will be having a flower like pattern. So another term you want to remember here is Blenderhoffli phenomenon in sporothrix. So it is nothing but the yeast cell will be there, which is surrounded by eosinophilic mass and antigen antibody complexes. So such this halo, it is described as Blenderhoffli phenomenon. Okay. So you want to remember cigar shaped cells. So you can remember like spore. If you smoke cigarette, sure there will be some of these spores usually present in the lungs. Okay, like that. And I told sporothrix is called as a rose gardener disease. So remember flower-like pattern. So treatment here also, it is an itraconazole. If it is disseminated infection, you can use amphotericin. So coming for next, it is a Dinosporidium sea berry. So it is a lower aquatic fungus or the hydrophilic protist. Okay, so the patient usually presents with a large polyps, usually present in the mouth, and there will be in history also. A person came with the complaints of an polyp, and he had a recent history that he has taken bath in the village ponds. Okay, so distribution and all no need to remember. So here histopathology usually reveals in spirules, okay, which consist of an endospores. The another point is this fungus has not been cultivated yet. This can be asked in 1 mark also, and it can be strained with music armament strain.